Hi, Brenda Care Queen here with the Hospice Care Plan. So Nancy and I have been talking about the use of Lorazepam and Haldol, and what we're going to talk about today is when do you know which one to use, or both. And I'm going to give you my preference, but your hospice, directed by your hospice doctor, is going to be the one who's really going to direct that, and they know what they're doing. I'm just going to give you the foundations of how I think they work and how we at our hospice like to use them. I think of Haldol as working directly on the brain and just slowing that spinning, and so that you can just step off for a while and take a break. So when people feel just a little agitated, irritable, grumpy, can't sleep, I like to start with just a little bit of Haldol because it's not sedating. Now, people go to sleep sometimes after Haldol. That's because they're exhausted and their brain is spinning, and when it slows down, they can rest. But Haldol itself in these tiny doses isn't sedating. It's also not, the body doesn't get used to it like it does Lorazepam. It's not addictive, and so you can start and stop as you like. As people come on a hospice, I like to introduce it first in small doses as needed, or even consistently up to 3 times a day. If you're seeing increasing dosing of Haldol and it's not helping, then you know it's probably not doing what you need it to do, because Haldol is best used in these little doses, either sporadically or consistently, just to take the edge off. Sometimes people call it Hello Dolly. They just can step away a little bit. Whereas Lorazepam, being a benzodiazepine, I think of it more as coating the central nervous system. It makes you sleepy, muscles are weaker, and it does really help with anxiety and more profound agitation. And I tend to start using it in the transition to active part of dying when confusion increases. And especially for the elderly or the really frail or people with dementia, I tend to wait on it because it can add to confusion. But saying that, sometimes a little tiny bit of Lorazepam at bedtime can really just help people sleep at night, get a better night's rest, and then they do better because it's cleared their system. I know this all sounds very vague, but then sometimes if the intensity of the anxiety and the agitation is a lot, we give it consistently. And sometimes we'll schedule both Lorazepam and Haldol. Sometimes I'll do Haldol 3 times a day, and in between those doses we'll do Lorazepam 3 times a day. And so there's something always steady kind of working in the background. I know it still sounds a little bit vague, but they're both used for anxiety, agitation, even delirium, but they work a little differently, and they can work in combination. And remember, we're using these in little doses. So it's important to ask your hospice team when to start using it, how much to use, and always keep track of what you're using with little comments. Here in the Care Plan booklet, we have a great, it's called a PRN or as needed sheet that you can track day, time, how much was given, and then comments about it. So, and try not to be afraid of them. And sometimes when people try a dose, it didn't work. You're gonna have to try more than 1 dose, and it's best to have somebody around in case there's not a great reaction. But these are standards of care in the end of life, and it's worth giving them a try, and with some trial and error, and work with your hospice team. So best of luck. And if you want to know more about how to really take care of the hospice patient at end of life, get Nancy and my booklet. We wrote this out of decades of experience, the Hospice Care Plan. It tells you what dying looks like, how to manage symptoms, to know when you're in transition and active dying. You can go to the shop page and get a copy. It's only $17. Thanks.